The epidural debate is one of the most heated topics in pregnancy groups, with strong opinions on both sides. As a midwife who's supported all kinds of births, I'm here today to give you the unbiased facts to help you make that decision. If you're new here, welcome to my channel. My name is Liz. I'm a certified midwife. And today I want to make this video about epidurals versus unmedicated births to help you make the decision that works for you. I strongly believe in no right way to do things, but knowing and having all the facts and making a decision that works for you, your baby, your family. So I want to start by saying, let's just acknowledge that those contractions are very much needed to push down, open the cervix, push your baby through the birth canal, and eventually you can birth your baby. But pain tolerance varies from one person to the next. In many parts of the world, they have no option. There are no pain relief options. Childbirth happens wherever it happens, especially in very poor or rural communities. But in a modern world where we have pain relief options, it has become the debate where people often query if it is still considered an achievement if you gave birth vaginally but with an epidural because you didn't suffer any pain. Well, I'm not getting into that debate either, but people have different pain tolerances and we have modern medicine available, and many women opt to choose for this pain relief and many opt to choose unmedicated births. Both are okay. As much as I am, as a midwife, very partial to the unmedicated birth because I've seen how women feel empowered by that, I have also seen many women traumatized when they didn't want an unmedicated birth, but they ended up having one for whatever reason, and that they didn't go home feeling empowered, but they went home feeling traumatized. And that is why there is a place for pain relief and epidurals during labor, because it's not the same for everybody. This is the most effective pain relief option available. And you might already know how it works, but essentially you have a tiny little needle that they put in your back through which they inject medication. It goes into the epidural space in your lower back. They inject medication, the needle comes out, it doesn't stay in your back, and then there's a tiny little tube that stays in your back that is connected. They usually pull it over your shoulder and they secure it here with tape or something, and it is hooked up to an IV line with the same medication inside that runs through a machine, and this gives you an exact calculated amount of fluid per hour. Once this epidural kicks in, your body is numb from just below your breast all the way down, so you might feel pressure. You might sometimes be a little bit less numb on one side versus the other side, but generally this is the most effective pain relief. You can keep it in until you give birth, or sometimes they stop it or they switch it off when you reach about 8 or 9 centimeters, that you can have a little bit of feeling when you start pushing. This is all dependent on where you are, what your birth plan is, what you've discussed with your doctor, what's the hospital policies. Like, there's a lot of things, but this is something you need to talk to your doctor before you decide whether you want to have it or not, before you just get going. So obviously the pro of having an epidural is the pain relief. Well, the downside of an epidural is you are usually not able to move. There is something they call a walking epidural where it is not as strong and you can move around, but because you can't feel much, the risk of falling is higher, so you can't walk around without anybody with you. And some moms don't like the feeling of not being able to move their legs, so majority of moms do end up just lying down in bed, so you can't move. Movement helps labor to progress faster. So an epidural can slow down the labor progress somewhat, or sometimes even stall it. Initially, it might affect your blood pressure a little bit, so there might be a moment that you're not feeling well, you might be nauseous, the baby might not like it. This is usually temporary and they fix it with positioning and some fluids that they give you. When you have an epidural, the monitor for the baby has to stay on the whole time. It's not intermittent anymore because you can't feel anything, so you don't know how much the baby is moving or not moving. So this monitor has to stay on, but since you're not moving around, it might not bother you too much, but it is constant monitoring then your blood pressure, the baby, the IV fluid. You get an IV line in your hand as well to give you extra fluid. So there's a lot of monitoring that is happening. by the time that you are fully dilated, and if you don't feel anything, so if it's given to you until the point that you give birth, the chances of having an instrumental delivery, like a vacuum or forceps, are higher because you don't feel the pressure as much as you would without an epidural. Even if you're pushing as hard as you can, if you can't feel the pressure down there, it definitely impacts how well or how effective, I'd rather say, you can push. So it often ends up in instrumental deliveries, which has other risks for baby, albeit very small. Any instrumental delivery has a risk of some injury to the baby. The forceps can cause bruises around the face. A vacuum delivery on the head might cause like swelling or a hematoma. So it's not without risk for the baby. And that is something that you need to consider when you talk to your doctor about an epidural. I've seen many moms with epidurals also deliver without any instrumental deliveries. So it's not to say that it will happen, it's just chances of it happening are high. With an epidural, there's also a cutoff time when you can get it. If you are after 8 centimeters or you are fully dilated, you want to start pushing, you can no longer get it because you won't be able to sit still while they put it up while your body is trying to push this baby out. So normally by like 6-7 centimeters, if you wanted an epidural, that's the time you want to get it up before labor is too intense and you can't keep still long enough for them to put the needle in safely without you wriggling or moving during contractions. With an unmedicated birth, you feel exactly how hard you have to push. You are mobile. You can walk around, do what you need to do, bounce on a ball. You don't have any IV lines connected to you. You don't need to be on the monitor continuously. You have freedom to move around. But if you are pushing, then obviously the intensity of the pain and the baby stretching the vagina, that you will feel to its full extent. And that's the part that many people are also scared of, in addition to the intensity of the contractions. So you need to make a decision now. I can't make the decision for you. I can't tell you what you should do, but I can give you a little bit of a checklist just to run through and see kind of where your head is at. You can factor these things in when you have to make the decision. Your birth setting is really important because certain birth settings allow epidurals while others don't. In hospital, anything is basically allowed because the resources are there. If anything goes wrong, there's a complication, then the operating theatre is just around the corner. In birth centres, you might not be able to get an epidural unless they have an operating theatre on standby. If there's a complication and you're able to get to the operating room immediately, generally in those instances, epidurals are allowed because it can have complications for you, or sometimes the babies are not happy when the epidural is up and the mother's blood pressure drops significantly after an epidural, like too much, and that affects the baby, and they might actually need to take you to theatre right away. In the setup of a home birth, for instance, you cannot have an epidural. That is not an option because there is no backup operating room available. Then obviously, how do you personally feel about it? How strongly do you feel about wanting an unmedicated birth and the empowered feelings that you might have had before, or that you want to have because this is what you've read or what your friends have told you and you want to have that experience? How strongly do you feel about that versus wanting a vaginal birth because you don't want to end up with a Caesar and recovering from a C-section, but you don't necessarily want to have the unmedicated experience that badly? You just want to basically avoid a C-section with as little pain as possible. So you will know on that line, where do you lie? Where do you see yourself? And that insignificantly impacts the decision that you're going to make in the end. The length of labor. So you might say that you want an unmedicated labor, but your labor has been going on for a very long time. You might be exhausted. And an epidural, taking away the pain, can actually give you time to rest a little bit while we are waiting for things to pick up with labor. They might give you something to enhance contractions a little bit. So there are benefits in that instance to just help you get a little bit of rest. You have to consider medical factors. So certain medical conditions might be contraindicated for getting an epidural, and certain might actually necessitate getting an epidural. So for instance, if you are having high blood pressure issues, an epidural might actually be useful for you. If you have any sensitivity or allergic reactions to certain medications, an epidural might not be an option at all. And then also remember flexibility. So you might have plan A, but just keep in mind that no birth plan is 100% guaranteed. Things might change. You might want an unmedicated birth, you get to 4 centimeters and you realize this is not for you, please get an epidural. Or you might be sitting there thinking, oh no, you know what, I'm just going to go for the epidural. In the moment, you're feeling so empowered that you say, no, thank you, and you have an unmedicated birth. It's okay to change your mind. It's absolutely okay. You don't have to stick to whatever plan you had beforehand. So rather than making a rigid plan beforehand, just have a flexible option. Go through all the options that are available. If you want an unmedicated birth, plan for that, prepare for that, but read up and understand what options are available, because you might change your mind once you're actually in labor. If you want an epidural, or you want pain relief, or even if you wanted a C-section, just understand what an unmedicated birth is about, because you never know if you end up in that situation. Maybe your baby was born at home before you even made it to the hospital. Then at least you understand what is going on and what you can expect. The most important thing is to feel supported in the decision that you make. Whatever you decide, it's okay. It is absolutely amazing to have an unmedicated birth. I didn't experience it myself. It is something I've always wanted to have, but with twins, I ended up in an emergency C-section. But I've seen it's a magical moment. I've seen these moms go through this, and it was always something that I really wanted. But in the moment when I had to make a decision and I had to consider what was the best for that instance and for my babies, and that's why I chose whatever made sense in that moment, even if it was not what I have wanted all along. That's why I'm saying, don't hold yourself and your value as a mother or as a woman against the method of your baby being born. There are many factors involved here. Make the decision that is supported by your family. And you need to know that whatever you decide, you need to be okay with that. Afterwards, if you get forced into a decision, it is definitely going to affect you in the long term. And a lot of moms being forced into having a birth that they didn't exactly want, but because everybody expected it from them, whichever way it is, that actually impacts them in the long term. And I've got a video here about birth trauma, because birth trauma comes in so many ways, and one way that a lot of women experience birth trauma is by having a birth that someone else expected from her, but that she didn't actually want. Or that it turned out differently that she wanted, but she wasn't prepared for it. So on that preachy note, there's no right or wrong. Make the decision that works for you. Make the decision that you are going to be okay with at the end. And don't let anyone make you feel guilty for your choice.